Hello. Today is a little bit of touchy topic because people have requested, what should I do? Actually, I have a patient contacted me by Instagram, very close friend with another friend of mine, big famous producer in Mexico City, and she wanted to know how was the danger of having a dental treatment with sedation and without sedation. Are we gonna sedate the kids because we're gonna do conscious sedation? Are we gonna do really something about sleeping the kids? Or in my case, I have to tell you that I was gonna show you a very funny picture of mine. I will place it somewhere around this. And it's where I requested, believe it or not, to have sedation for anything they're gonna do in my mouth. I have zero tolerance for pain. And being somebody that suffered from a dental anxiety, because when I was a kid, I have a dentist when I was 6 years old that put a needle in front of me and said, open your mouth and now you're gonna have a problem, because if you don't let me work, I'm gonna tie your hands, I'm gonna do everything was, and you have to listen, right? So that's a trauma that created when you are younger and younger, and your parents at that time said just let them treat you, right? So what I decided to do is dedicated my life in dentistry to help my patients to feel calm. So my office, I always said, is very personalized, and I give them a lot of time for breathing, a lot of breathing exercise. I try to teach them visualization, believe it or not, or I get them on the iPhone meditation with visualization, stress relief, aromatherapy I have. However, there are patients like me that no matter what you do, I'm not gonna let my poor dentist work. Now, in our countries, like in Mexico City or Latin America, it's not so much, we don't believe in sedation on that many years ago. Nowadays it's happening, but it's still a taboo that, like this friend of my friend asked me, who do I trust? How do I know who is doing it? And what should I do? And you need to be always sure that person who's gonna do the sedation is certified. Not many people say, oh, it's just the gas. I used to have a staff say, oh, it's just nitrous, doctor. No, it's not just the nitrous. You're gonna have sedation if you're a very nervous patient, and the kids of today, it's like an everyday thing for the pediatric dentist. They use the gas, which is the laughing gas, and it's a nitrous where you have in the mouth. I'm gonna show you pictures of that during the presentation. And you have in the mouth, you place first oxygen for 10 minutes, and then little by little in increments of 2, you are adding the nitrous until you have 3 and 3, if you want a 50-50, etc., depending on the percentage you want on the nitrous. And you have to know the weight of the patient, the age of the patient, the health of the patient, any cardiac problems. Not only that, I have a machine all the time that you're gonna see in one of my slides, that my pictures, where we measure the blood pressure, very important, the oxygen level, and I always try to keep it in 99, 98, 97. I don't let it go even 95. A lot of people in other countries have less than 95, but I try to keep my patients breathing by the nose very deep, that if they don't say, I don't want to spend the money in nitrous, and unfortunately we have to charge, because not only is the gas, we don't sell the gas, it's a service, and it's the time that it takes you to monitor the patient and be sure everything is correct, the preparation, and this is just for nitrous. People think nothing can happen to you, but if your dentist is not completely concentrated, or he's trusting the assistant, and all of a sudden the patient falls asleep and the nitrous goes up and the patient stops breathing or start breathing by the mouth, my machine will tell me right away. But my whole staff is very, very trained to know what to do, but I still have the time to turn around and look at the machine with different sounds and tell me this is the level of oxygen. And I've been taking for more than 10 years seminars on oral conscious sedation with the sedation doctors is a group. Also, USC offer the courses and UCLA. So you need to have the certainty that person is certified. Nitrous, I think, is not regulated in California, or is now. I always have it. I don't want to do any type of sedation because you need to know what to do in case of emergency. We always have a tank of emergency in a case. There's another type of sedation that it's called conscious sedation, where you sedate a patient with Triazolam, which is a pill that you will not remember anything. And that's the most common that I do in my office. So we make a combination of different medications. One is Triazolam, hydroxyzine, and depending on Lorazepam, we will use, depending on the type of the patient, depending on the health, the weight, the height, the needs, the strength. And it's so important. Like if I have any little problem with the blood pressure, I always make sure, no matter what, whether it's very healthy, the patient, I talk to their physician to see if there's any problem. Because sometimes the patient doesn't tell you everything. Or say, oh, by the way, I have a stent last year in my heart, but I've been doing okay, but I forgot to put it in my medical history. So no matter what sedation they're going to do, whether it's a gas, laughing gas, I always get ready to talk to the physician. If at the last minute the patient wants it and I am able to do it and we have the time to do it, I still check with the physician, or I will not do it because you can get in trouble if the patient has a problem. One of the problems I have with the patient is that he took Vicodin. I don't know if he combined it with a Xanax. So when we start doing the conscious sedation, this combination with the narcotic was a disaster. So I have to call Dr. Matsunaga. Not only that, we have a medication to contrast the drug, and we have to put it through IV, the medication, and we bring back the patient. But his respiratory level was very low, and we can lose the patient. And even if you say, oh, I'm not going to be, if the patient swimming, you have in your conscience the patient die in your chair. That's the most important, and you can prevent that. So if you're going to see a doctor, be sure that that doctor has knowledge in sedation, have a course, a seminar, or has some type of certificate. I go every year to have my hours of sedation, but I have to go every 2 years. During the pandemic, we couldn't, we did it through the internet, but now you have to be sure. So if you go to the first sedation with the nitrous, it's okay. Depending on the amount of time, you can do the conscious sedation with pills, and you're going to give a pill a night before of a Lorazepam or diazepam. And I mean, it's a lot of medications that we have to manage in a different way, so the patient is going to be breathing correctly, and I always have oxygen hook in their nose, so there I am sure they are having the right sedation. Now, when it comes to IV sedation, that is, I am here with Dr. Matsunaga. IV sedation, it's an amazing sedation, because what happened is I have Dr. Matsunaga here with me. She was a student of Dr. Vijak. As a student, she was an amazing, excellent dental student, and then she went to specialize in dental anesthesiology. And as a dental anesthesiologist, they have some limitations, but also you can have physicians that went to study anesthesiology, and that's the only they do. They come to the office, they charge per hour. It becomes a little pricey, even if it's 1 hour or two, but if you're gonna have treatments that are complicated, like in this case, this kid suffered for several problems with autism and between another ones, and I have to require a lot of medical authorization. But not only that, have really lucky to have Dr. Matsunaga during this treatment, and the patient that was finishing here her treatment, and we were ready to wake her up. Then we were very happy to treat that patient during the root canal. Was extremely difficult, but the patient that was not way to control her, no matter what, because of the disease of the patient, then it was a handicapped kid with some kind of incapacity, and this allowed us to do the root canal and save that tooth from the patient. I want the mom inside, but she decided to be outside. So we have a very successful treatment. So when you tell me What is the difference with no sedation? If you can breathe, visualize, do breathing exercise with the nose only to oxygenate your brain, you're going to survive. But if not, your fears are besides yourself that you cannot control, it's better that you let your dentist to give you conscious sedation, nitrous or IV sedation with anesthesiologist. Thank you. You have any questions, put your comments in our channel in YouTube, subscribe to the like button, and also remember Instagram and TikTok. Bye-bye.